morning when I came here, so.
What time? What we looking at on time?
But I've had quite a few deaths, right, over the last couple of weeks.
It's been terrible.
I know.
Everywhere.
I got 27 employees that are positive and 41 self-monitoring.
Honey, we're about eat up with employees too.
Yeah, we are, I know.
Hey, you know what? I'm gonna open this thing. Hey,
We
Chief, come here and open
loaned
this
Coleman
wonderful
event.
little piece of paper. Do what?
We loaned Coleman a vent.
Yes, we know. We had to call and
Okay.
ask you to do so. And then they were able to access some from,
Good morning, Decatur. Thank you for joining us 1 hour later today. As you've noticed, cases are increasing not only in our community but across the country. Dr. Karen Landers of the Alabama Department of Public Health said it's time for residents to make a greater effort to stop the virus spread because the state is at a tipping point. Huntsville Hospital reports that it has 214 COVID patients system-wide. It's the highest figure since August. Question is, why? Alabama Department of Public Health officials said we do see persons that are gathering together in groups of 10 or more as parties, fall parties or Halloween parties, or in congregate work settings and some church-sponsored activities. The holidays are almost here. Let's make wise decisions to stay well. We must do our part to avoid another shelter in place because we know that it'll have a significant impact on our economy, business owners, and their employees. Now, with us today, we're thankful to have with us Judy Smith with the Alabama Department of Public Health. Judy, thank you for joining us today. Appreciate you being here. And then Decatur Morgan Hospital President Kelly Powers, thank you for joining us today.
Thank you.
So, just a few updates as we try to give each week. As it relates to COVID cases, we have 5,101 confirmed, which is right at an 8% increase over the previous week. As of today, we're at a moderate risk county on the Alabama Department of Health risk dashboard. I would take that at a high risk is where I'd probably try to walk. Believe it or not, Thanksgiving is next week. Like we said last week, we've uploaded a full list of COVID-19 holiday safety tips to our homepage on the city website. We have a new URL, our web address there, and that's cityofdecatur.al.com. Again, that's cityofdecatur.al.com. This year we'll all be making new traditions this Thanksgiving. Consider, baking a favorite family dish and leaving it on a elderly neighbor's doorstep, or call and talk with a senior citizen who may not have family visiting with them. Just be kind. That's the big thing. This is the season of kindness, and we want to exhibit that. So with that, Kelly, we'll start with you. Let's get an update, if you don't mind, from the hospital.
Sure. This morning we had 36 positive inpatients and 6 presumptive positive patients, which brings us to 42. The all-time high of 39 was back in October. So as you mentioned, we are seeing an increase in inpatients. We've got 5 in the ICU with 4 on the vent. I had 1 open ICU bed this morning. The thing that's very concerning to me is the number of employees that we have out. We've got 27 positive employees and 41 self-quarantining, waiting on their test results or based on an exposure. So very concerning about the increase and the positivity rate that we're seeing in Morgan County and surrounding counties. One concern that I have, we're seeing a lot of mental health issues, a lot related to teenager, adolescents. Again, I think one thing, being in this pandemic, we need to make sure we do check on our elderly and these other people who, maybe need to know that this too shall pass at some point. Things will not be back to normal like we know before, but we are seeing a lot of mental health issues, depression, suicidal events and things like that. And I just want to make sure that everybody takes a second to check on the teenage population, college kids especially, with that. So I just want to share that with you.
Thank you. Yeah, the clock continues to tick and brings a new day and new mercies. And
Yes.
Glad you shared that. Thank you very much. That just breaks my heart to hear.
Yeah,
hear
it
that
is.
concern.
Very much so.
Miss Judy, good to have you.
Thank you, sir. Let me say up front, this has been a tough 2 weeks for the Department of Public Health and for all of our healthcare partners. We have seen numbers soar everywhere. Certainly they've soared in the nation, but at the same time, our biggest concern is what the impact that has been for Alabama, as well as the impact that has been for Morgan County. And just to talk about the nation as a whole, and many of you know that a lot of things are closing down again, a lot of increased restrictions across the nation. Fortunately, we are not doing that in Alabama at this time, and we hope we don't have to. But right now in the United States, 11.3 million people have now had the COVID virus, and there have been 252,000 deaths. Let me just say that of those total numbers, 1 million of those folks were recorded this past week. Now in Alabama, we're well past the 200,000 case load at 219,232. The deaths in Alabama are 3,249. And let's remember, that is a tremendous number, but let's remember every single one of those numbers is not just a number. It is a person, it's a family, it's folks that have been terribly affected by this pandemic. In Morgan County today, we're at 5,466 cases. We currently have 41 deaths recorded. Now 39 of those are confirmed and 2 are presumed. A bigger issue, though, right now is that 17.6% of those cases have occurred in the last 14 days. In addition to that, we are seeing an uptick in people requesting testing, people needing testing, and right now the rate of positive test in Morgan County is roughly 30%. It's 29.6%. 3 days ago, it was 31%. Maybe down because we didn't test over the weekend. So Kelly's already talked about the hospital situation, and what I'd really like to do today is just talk a little bit about where we are and the 3 big components of that. And I'm going to start at the backside. And this MDS, mask, distance, and sanitizing, that's prevention. On this side, vaccination, that's prevention. In the middle, we have treatment. Now, I want to tell you, folks, even if this is a bitter pill to swallow, even if that mask is a difficult thing to do, you know, this is much more horrendous. And I want to start talking about this, and I want to build on what Kelly has already said. We're talking a true measure of a lot of this is how many people are in the hospital and how many are really, really sick. And if you listen to what Kelly was saying, you know, about 1 out of 10 in the numbers that she gave you ends up in the hospital. Once in the hospital, there's a greater number that end up in the ICU. And then of those ICU this past week, almost 70% of them ended up on ventilators. That is a horrendous situation for our families, for people that we know. One of the things I will say about this situation right now is it's become more than when we first started talking 8 months ago. It's become very personal and very impactful to a lot of people. All of us at this juncture now know somebody who has been sick, somebody who in our family who may have died, or somebody who has a relative, a friend, a very dear friend of us who has lost a brother or lost a mother or lost whatever because of COVID. You know, treatment is great, but it is a big pill to swallow when we could take care of these other 2 pills. So it is just a huge thing. Is this really what we want when we have the opportunity for the other sides? And I'm going to talk about those in just a second. I do want to mention, in addition to the treatment, though, there is a lot of stuff going on. Well, first of all, let me back up and say, I thank God that we have our hospitals. I thank God that we have our nurses. I thank God that we have so many things, because if we didn't, we'd be in worse shape than we are right now. I will say that with the growing numbers, we can add beds, we can add rooms, we can change our units, we can move to Parkway and have all these things, but we can't add medical staff. A lot of our medical staff have already, when questioned about what they were going to do for Thanksgiving, a lot of them have already said, we won't be doing anything because numbers are up so much. We'll be at the hospital taking care of folks. So this is kind of the situation that we're in. To go back to talk a little bit about the treatment, most of you have heard of the drug remdesivir that is available in somewhat limited quantities. It tends to be used only for those who are most sick. It's a very expensive drug. Is it worth it for a life? Absolutely. But you've got to get it. It requires multiple doses, and it's a tough thing to do. In the next few weeks, what you'll be hearing is Alabama will be getting some antibody treatment, which is wonderful. The problem is it has its own problems too. It is an outpatient medication that will not be used it cannot be used for in-hospital stay. And it does require an IV infusion, which takes about an hour. Then you have to be observed for at least an hour after that to be sure that there's no complications. So it's not going to be an easy thing to do. This part right here, this is a big pill to swallow. So let's back up a little bit then and talk about prevention. The first thing I want to do is talk about the vaccine. We are currently planning right now, the vaccine will be coming into Alabama by the end of December if nothing happens. They will be limited doses. As a matter of fact, the federal government has notified us that there will be 30 to 40 million doses released by the end of December. But that's for everybody in the nation. When you look at the population of this nation and the population of adults in this nation, that's not going to get even close. The other thing is that it's going to be a 2-dose vaccine. There's still a lot of information that's missing out there in terms of the side effects, the amount of availability. I will tell you that right now the current federal plans and federal guidelines is that the vaccine will be given to start off with to healthcare providers. So Kelly and her team will probably get it before anybody else. Will public health people get it? Probably not in the first round, because Kelly and her folks take care of people in the hospital, her physicians, her doctors, those folks. So the people who are most likely that we cannot afford to have out of the hospital, they will get it first. And so that'll be hospitals around the state. Then later, probably in the spring or maybe in the summer, the vaccine will become progressively available for other folks. Again, it is a 2-dose thing. First of all, we're going to have to convince folks that it's a good thing to do. Now, Pfizer has stated that their vaccine is 90% effective. Moderna, who will be the second one to probably be approved and come on, has now, maybe in a little competition, said that theirs is going to be 94.5% effective. But both of these are 2-dose vaccines that require special handling and special treatment. The other piece to this is, even with that effectiveness, first of all, everybody's not going to take it. We just know that. It's not going to happen. Those that take it, there is still some error rate in terms of the effectiveness of the vaccine. So when we add all that together, are we going to be totally over everything when this vaccine becomes available? Absolutely not. We're still going to be dealing with a lot of stuff that we have right now. But the point I really want to make today is that right now, this is over here. We're not there. We don't have that yet. Now, that said, this is what we do have. This, for a lot of people, has been a bitter pill to swallow, but it is the most effective thing that we have right now. Folks, if somebody handed you something, if they handed you a rabbit's foot or a coin or whatever and said, if you take this, you're going to be able to save somebody's life, I would like to think that most of us would take that and we would try to save somebody's life. What we're trying to do right now, even if you don't believe in it for yourself, we're trying to hand people masks and say, just if you don't want to do it for yourself, do it for somebody else. Help us protect our community, help us to protect each other. So, but the big issue, we've got this right now. Maybe it is a bitter pill to swallow, but it's a heck of a lot better than where folks are with this right now. Masking, distancing, and sanitizing. And, the only thing we know to do is just to urge you to do this. Now, let me also say that we are going into the holiday season, as the mayor has already said. Right now, where we are for the last 2 weeks is because of the beautiful October weather, the blessing that we got for October. We had playoffs for ball games. We had Halloween stuff. We had folks getting together. We had outdoor festivals. In some counties, we had community fairs, and look where we are. If we don't do this, you know what we'll be giving folks for Christmas? It won't be something fun. It'll be what we've got right now, and maybe even worse. Now, we urge you, as public health providers, we urge you to please consider this. This is so much easier and so much more meaningful than this. If you're going to give somebody something, please give them their health and their safety this year. You know, let me also say that one of the biggest difficulties I think we've had in terms of getting people to wear masks is that there's so much variation in the symptoms that people have. And I have a friend who thought this, who really thought this was a bunch of bunk and all this kind of stuff until their son got sick. Their son was 40-something years old. He was in the hospital and he almost died. All of a sudden, this was very serious. In some of these other situations, you know, folks have just not been very sick and people are totally disregarding it. It is true that 85% of people will recover. Now, some of them are going to be a lot sicker than others, but 85% will recover. But that is 15% that won't recover. I don't want that to be my family. I don't want it to be your family. I don't want it to be the folks we know, our church members and the people we care about. So, you know, I would like to end with saying that we're in the Charles Dickens season, you know, and we all know Charles Dickens from A Christmas Carol, but he also wrote another book at a time of war in the French Revolution, and the first paragraph in that said, "It was the best of times, it was the worst of times. It was an age of wisdom, it was an age of foolishness. It was an epoch of belief, it was an epoch of incredulity. It was a season of light, and it was a season of darkness." Folks, let's all do our part so everybody can have a good holiday season and we can get back to where we need to be. Thank you, Mayor, and thank you for allowing me to be here.
Thank you, Judy. Thank you for your illustrations. You're very effective in how you communicate, and we appreciate your leadership.
Well, thank you so much. Listen, let me add one other thing, and I appreciate that, Mayor. Your task force in Morgan County actually ended up doing this for the state of Alabama. Last week, they asked us to work with them to try to get something because the mayor and his group and the chief care so much about the businesses in this community, and they ask us to do something to please beg people to come in when they come into the businesses to wear their mask. And so the state health department, in working with Morgan County came up with this task force, came up with this flyer that we will be distributing to any businesses that want them. We'll be putting them everywhere. You know, these folks need your business. They want your business. Please use them during the course of the holidays, but please don't put them out of business. They're begging us to beg you. Please do your part so we can stay in business. So, Mayor, these will be made available to all of your folks. Okay? Thank you, sir.
Thank you very much. All right. Well, thank you for joining us. Do we have any questions?
I'll start with Judy. You mentioned that we are getting to the point where a shutdown, you know, they don't want to do it. You guys don't want to do it. At what point is that possible?
Well,
Is it possible?
I don't think we could even speculate on that right now. You know, I will say, you know, there are a lot of critical things that come with doing a shutdown, and it's not just the economic piece. It goes back to some of the things that Kelly has said. It's the emotional piece. It's the education of our children. It's everything. That is a critical stopgap when the state really feels like there is no other choice. And you know, all we've got to do to get out of that is do this. We've already proven it. We did it as soon as the first mask ordinance came. Numbers went down. Things were great. Geez, the the end of the season games came, and Halloween came, and the beautiful weather in October came, and we decided, geez, we don't have to do that anymore. Which I want to thank you for saying that. The other thing is, in wearing a mask, can I beg two things? First of all, wear it. Second of all, cover your nose up. Listen, I see people without masks, and I see people with their nose exposed. There is a reason we do the test in the nasopharyngeal area. There is a reason. Please, I really don't care that you've got a cute nose. Please, I don't want to see it right now. So please cover it up.
You mentioned the vaccine. I've heard a lot of people relying on this. And I get that it's a hopeful thing to wish for, that it's going to be available. But you said, you know, it's not going to be available to people like me. It's going to be available to people who are working in the hospitals and the at-risk people. What message do you have to those people who are even leaders in our community and across North Alabama who say, oh, there's going to be a vaccine, it's going to be fine?
It is not the end all to all end alls. even when we have the vaccine, when you go to the big box stores, are you going to know that everybody that's in there has taken that vaccine? Are you going to know that everybody has taken their second dose, which is necessary to achieve the effectiveness, the efficacy as we call it? Are you going to know that? We may end up continuing the mask issue. I will continue it until I feel safe that it's okay for me and my family to be out there.
So with the second dose, what's the time frame between the first and the second?
It varies by the vaccine. The Pfizer vaccine right now is 21 days. The Moderna vaccine, which are the two that are probably going to be, is 28 days. So it's 4 weeks. So, and one of the things that we're also working on right now as it becomes available for these groups is a notification process to remind people to get the vaccine. Now, let me also say there is some evidence right now that, we have a lot of people right now that say, I'm not taking another flu shot. The last time I took that flu shot, it gave me the flu. Well, there is some evidence right now that this also, kind of like shingles vaccine, which is a 2-dose thing, is going to give you a sore arm. It's going to make you feel bad, maybe even for a couple of days. And so the question becomes is when this happens, even if folks take the first one, are they going to come back and take the second one? So there's still a lot of stuff up in the air in terms of us being protected enough that we can drop the ball game on something this simple. Something this simple. I hand you a pill, a rabbit's foot or whatever, and say, go save a life. Even if you don't believe in it, go save somebody else's life.
You guys have been sitting up here for months begging people to wear masks. How concerned are you at this point? We're seeing case numbers higher than we've ever seen, and hospitalizations almost as worse as we've seen.
Obviously, from a public health perspective, we're very concerned, and it's like I said a little bit ago, our other concern is what's going to happen with Thanksgiving coming and then Christmas. If you take today, or if you take last week when the numbers just soared high, and you back up, you will see Halloween, the fairs, the playoffs, all this kind of stuff. Families want to get together, and if they can do it outside and they can space themselves on the porch and they can really behave. Listen, as I said in a previous meeting, not involving this, put Uncle Joe out back. You put him out back when you didn't want him smoking in the house. If he doesn't want to wear a mask and he don't want a distance, put him out back and pray that it snows on him. So, and keep also in mind that there's some of these folks that are kind of excited about this because they didn't want Uncle Joe coming to dinner anyway, so he may not come. But we are very concerned. I will say that one of the largest indicators in this whole deal is Kelly's situation. It's the hospital situation. Today, if I knew I would be okay, I'd be all right with getting COVID and moving on with my life. I'd be all right. But what happens if we do that? Who's going to die? Who's going to end up in the hospital on a ventilator? Again, I don't want it to be my family. I don't want it to be the mayor's family or Kelly's family. We don't get to pick and choose. It's kind of like darts, and I don't want to be the one that throws the darts. I don't want to be the one that gets hit with the darts. So we've got to do what we've got to do. Part of Thanksgiving and part of the blessings that we have are taking care of each other. This is a minor thing to do to take care of each other.
Couple questions for Kelly. So you said 27 employees positive and an additional 41 in quarantine. That's well over 60 employees. That has to be negatively impacting the hospital. Can you tell me a little bit about what's going on?
It is. Luckily, they're, spread out, and we have added more PRN staff to come in and help. But we're real close to stopping elective surgeries again. We are discussing that internally. The good thing about Morgan County is a lot of our elective surgeries are outpatient, so we don't have to do that. But we are talking to some of our physicians about possibly, looking into that. But yes, it is negatively impacting us.
That was my next question.
On top of the staff that we have being so tired, and worn
Can you
out.
talk about fatigue? I spoke with the doctor at Athens Limestone last week, and he said the biggest thing that we're seeing is, yes, we're prepared for this increase to happen, but, we're so fatigued that
Yes.
again, negatively impacting staff.
It is, and we're trying everything we can to give them, their time off, their breaks, get the meals and the signs and the wonderful things that our community did. We're trying to start doing some of that again, just to kind of push through, as Judy said, this huge surge that it looks like we will probably top our numbers, I would think, this week or next week, another all-time high. in everything. One thing Judy didn't mention was we had to loan Coleman a ventilator from Morgan County. So Coleman also has a huge spike going on right now in Coleman County. And the thing that we don't talk about a lot is we only have so many ventilators, so many ICU beds, and so much medication. So we kind of run up against some of that as well.
How close are we to exceeding those factors that you just mentioned?
Right now, we're good on medication. I'm tight always on ICU beds. We have to do some makeshift things in our emergency room and things like that. Ventilators, I'm good right now, but that doesn't mean tomorrow that I might not be. Because with this many patients in-house, we never know when a patient, goes really bad and has to be put on a ventilator.
Can you kind of explain to people, obviously you have dozens of hospital beds open, but that doesn't mean that they can treat, intensive care patients like you said. So can you explain, why you're close or at capacity to treating COVID and then severe flu, other injuries, stuff like that?
Yeah, ICU beds are different from your regular acute inpatient bed. You have to have line of sight on the patient all the time. There's a lot of medical hookup and different pieces of equipment in the room that do not fit in a normal patient room. Not to mention the access to just getting to the patient quickly and helping them when they do code or something bad happens. So we have 19 now, and we've had that 15 of them we've had since 1986. So we're trying right now to work on a plan to expand and add more ICU beds here.
Is the elective surgery just for Morgan County that you're considering, or is it system-wide?
System-wide.
The last question is update on the COVID unit at Parkway.
We do have more staff hired. There was at least 6 this morning in ICU, 6 this morning in employee orientation. And so we are now training them, and November the 23rd is when we're actually going to put patients in those rooms. We're going to do what I call a soft opening, and we're going to move the patients that are currently at Parkway. I think this morning we had 6 that were positive at Parkway. They'll go to that unit first, and then as we feel comfortable, we'll add more to get to 15, and then we're already planning to go all the way up to 36. As Judy said, there's a peak now, but we worry about a peak that's already estimated for January.
Last question for you, Mayor. As Judy said, I'm here every day. I see people not wearing masks every single day. What message do you have for your constituents in the community to really play their part and how crucial this is for even walking into the gas station to just wear a mask?
It's so important. We have, last week, we raised some standards here at City Hall to make sure that we're leading and staying healthy as a government. We've gone back to reminding everyone the importance of doing meetings by phone, by Zoom, conferencing, avoiding in-person meetings because of how the numbers continue to increase. Keeping our businesses open, our economy open is so important. We want to encourage people to continue to go and do business, but be respectful and wear your mask, as Judy has stated, over your nose. We don't want people trying to be the police. We have police to do that. So it's trying to keep our economy afloat is very important. We do not want to go back to a shelter in place. And I think it speaks to the part about our mental health as well. That's just, that's another element that we're seeing that we don't need to deal with.
So what message to the community, what would you say if someone came up and said, Mayor, I don't want to wear a mask right now? What would you say to them?
I'd say that neither do I. Neither do I, but it's just, it's a necessity. And it's something that we do out of respect for others.
Hey, Jenna, I want to add one thing to something that Kelly said. And one of the other things we need to remember in this community is it's not just COVID. It's not just about COVID. The hospitals take care of people every year that are sick with flu and many other things. One of the horrendous things that we got into earlier on before it peaked again was people put off care for things that could have been diverted had they gone on to get the care they needed. Some of them didn't want to be in position to the hospital. Some of them were afraid to go to the hospital. But it is so critical. I mean, we've got other illnesses going on besides COVID. These folks need to be there, and they try to be there. And let me also say to that person that didn't wear a mask, if you end up with COVID, we're going to do our best to take care of you. We're going to do everything we can. We're going to do what we have to do because we're medical people, and that's our job. Kelly's going to take care of you if you go to the hospital, and public health's going to do what it needs to do. So please, if you don't want to do it for yourself, do it for somebody else. Save a life.
Thank you.
Thank you, sir.
Amy, I believe we have a call.
Yes, about to put him on speaker. Okay, we're putting you on speaker now, okay? Proceed with your question, please.
Hi. Hi, this is Alexa Scott from Channel 31. My first question is to Ms. Kelly Powers, actually. Just going back to our hospital staff, I know that you said you all are trying to do your best with taking care of them as we go through all of this, but are we seeing any kind of strain with hiring more people, or how many more people can we actually add to your staff?
As
Does
far as
that make sense?
the COVID unit at Parkway,
Yes.
we're,
To the hospital, the Decatur Morgan Hospital right now.
we need some techs. So we need about 6 PCA techs and 1 night nurse. But other than that, we've hired everybody. And again, this morning, I've got someone from Philadelphia in orientation, so I'm really excited that we're bringing in some people just to see our great community. But, so we need 1 more night RN and about 6 techs if we had anybody that would like to apply.
Do you have any other questions?
Yes, one more actually is going back to the adolescents and their mental health. You were saying that you all may be seeing those with depression and suicidal issues. Anything else that we want to get out to the community as we continue to go through this? We also know that seasonal affective disorder is a real thing. Right now our weather is looking great, but we're moving into the winter season. So anything you'd like to say to that?
Well, mental health, I think one thing, and those of you who have teenagers know how social we were before the pandemic. And, you know, if there's Zoom calls they can do with their friends, the main thing I think I want to get out there is check on the elderly, but also check on these young college, adolescent children. Please check on them and just, you know, if anything, check on their mental status and help with that. Again, you can do Zoom calls with their friends, different things like that, just to have some social activity for them as well, because sometimes we know children can be resilient, but the mental health issue, it is real out there.
A lot of them are having to quarantine, as I understand it.
They are, yes.
Thank you.
Thank you, Alexis.
Any other questions? Okay, well, thank you for joining us today. Our next press conference will be Monday, November the 23rd at 10 a.m. Thank you. Be safe, stay well, and have a good week. Thank you.
Thank you.
Good job, Kelly.